Welcome to GS1 Canada's presentation on healthcare and pharmacy. First, let's start off by identifying ourselves. GS1 is a global, not-for-profit organization providing unique identification standards to over 150 countries, serving over 13 million subscribers across multiple industry sectors. GS1 Canada is one of the 111 member organizations with a subscriber base of over 20,000 organizations. Best known for retail barcodes, for which we are the only authorized provider in Canada, we also offer solutions and standards for supply chain from manufacturing to electronic health records. Our offerings can be divided into 4 basic groupings. They are identify, capture, share, and use. So let's begin. What is a global trade item number? Part of our identify category, a global trade item number, or GTIN, is a globally unique product identifier. But what does this mean? A GTIN is a unique identifier applied to a product to enable additional information to be retrieved or accessed. It is a globally unique SKU, or part number, meant to be used by every manufacturer, distributor, reseller, retailer, hospital, and consumer for all interactions with a given product. It is most commonly called a UPC or EAN and is encoded on products in a barcode symbology. The GTIN is comprised of 3 basic parts: the global company prefix, the item reference number, and the check digit. The global company prefix references the owner or manufacturer, where the product comes from or who owns it. The reference number identifies which product of theirs it is, and the check digit is a calculated number used to ensure that the correct sequence of numbers is read by a barcode reader. Great, so now we have a basic idea of what a GTIN is, but how is it used? Because of a GTIN's uniqueness, it can be used in different ways. It can be used for trade, and this is the predominant application for the GTIN, to uniquely identify the item being purchased or sold. Due to the sheer volume of items traded, there was a fear that the number of GTINs would quickly run out. So for the general retail environment, the reuse of GTIN was restricted to those GTINs which have been discontinued for a minimum of 4 years, meaning the product had to have ceased to be produced for at least 4 years before the GTIN could be reassigned to a new product. Currently, it is in discussion to meet the needs of e-commerce that all GTINs should be permanently assigned, and this non-reuse for all assigned GTINs is expected by 2018. The second way the GTIN was leveraged was for tracking and traceability. The uniqueness allowed for an ease of identification which could track who was given what, coupled with a lot batch or serialized information. The level of accuracy and security is astounding. Lastly, the GTIN could be recorded in patient records, but to ensure that the reuse of a GTIN after a product was discontinued did not corrupt patient records, the need for a permanent GTIN arose, one that would ensure integrity of patient files, track and trace initiatives, and general patient safety. What is a permanent GTIN and what types of product are impacted? Currently, in the GS1 general specifications, all regulated healthcare items may never have their GTIN reassigned. In Canada, a regulated healthcare item is any item which is identified with a regulated identification number or class. So any item marked with a DIN, an NPN, NHP, a DIN-HM, or are classified a Class 2 to 4 medical device are considered a regulated healthcare item. That means that anything from toothpaste to implants must be assigned permanent GTINs. Permanent GTINs may never be reassigned to a different product ever. Note the choice of words, to a different product. If a product, let's say a pharmaceutical drug, is discontinued, but is then reintroduced into the market, can we reuse it? To answer that question, we need to be a little bit more precise. So long as the product is identical to the previously offered product, the GTIN may be reactivated. But we mean identical. The same brand, the same DIN, the count, the format, everything. These permanent GTINs, also known as non-reuse GTINs, why exactly do we have all this fuss? So why are permanent or non-reuse GTINs so required? Well, as we stated before, regular retail items can have their GTINs reassigned after 4 years. But this is because the only real application of the GTIN in a retail environment is for the buying or selling of an item. But even these items are being lobbied to have non-reuse implemented for e-commerce applications. In a pharmacy and healthcare setting, the GTIN is much more. It can be used in patient records for track and trace applications to enable quick and accurate recall procedures when warranted, and it adds an additional level of patient safety when properly utilized. The life of a product does not end once it is sold, but continues to live on in the patient and in their files. It provides accurate information as to what was used when on who, and it cannot be allowed to be corrupted by assignment to something else. If one GTIN is assigned to multiple different healthcare regulated products over time, the results can include inaccurate electronic medical records. Inaccurate product identification is a risk to patient safety. Doctors rely on this information, especially during an emergency. Drugs may be administered to a patient with allergies or which interacts with another prescribed medication. Complex product recall results when one GTIN is attached to multiple products and multiple patients. How can a healthcare provider determine which product is being recalled? How can a healthcare provider identify which patient has the implanted medical device being recalled? Reduced traceability. Administered or implanted products cannot be tracked back to the patient if the product identification has changed many times. Verification of the product origin is difficult. We also have product identification mistakes. Products not compliant with global standards and, more relevant, hospital systems. This right now is the end of our session, and you're all now experts on permanent GTIN. But even experts need to double check things now and again. With this in mind, we have a service at GS1 Canada called the GTIN Ombudsman, and all questions related to GTIN or any GS1 identification can be directed to the email address above. Generally, a response should be received within 24 to 48 hours. If you want to review this session again, afterwards you can look at our Learn Module sessions, our LMS system. For a link to that LMS system, you please send an email to our healthcare department at healthcare@gs1ca.org. And now we will look to see if we have any questions from our participants. At this point in time, we have received no questions or any requests for additional information from our participants. I'd like to thank all of you for participating in this Learn module. And again, if you have any questions, please submit them to healthcare@gs1ca.org. Thank you very much.